Hey there, welcome to Mark in the Park, the podcast. I'm your host, Mark Milo, speaker, storyteller, and healthcare advocate. And this is the place for personal reflections, stories about mindset, hobbies, and purpose. And a reminder that life doesn't stop at a diagnosis. In fact, often the real journey begins after. So sit back, relax, and enjoy the show. Hello, everybody, and welcome back to another episode of the Mark in the Park podcast. Today, I am thrilled to have on a friend of mine who's a medical doctor, a neurologist, a movement disorder specialist, and one heck of a wonderful person, Julie Couric. Julie, thank you so much for being on the show today.
Thank you for having me. I'm honored to be here.
Well, Julie, I met you in person at a conference, but I have been following you for a while online. You've got a great presence online. And I want to talk about that, but also you're found online on Instagram and on, are you on TikTok too, or just Instagram?
I'm on TikTok too, same name.
As the ParkDoc, right?
Yes.
Okay. Now, ever since you first started posting, I love what you post because you're posting stuff they're little tidbits of information, like meaty little morsels for us to grab and go with, and it's wonderful. But you are a board certified neurologist. I was looking at your LinkedIn. You've got a lot of great experience, and you know your stuff. And now you're doing a little foray into to social media. So just tell me, start off with what made you go down the road to be a neurologist? I mean, you had your selection of medical fields to go into. What made you go into being a neurologist and then further to being a movement disorder specialist?
Sure. Well, I think the question should be, why wouldn't I be a neurologist? I think the brain is the most fascinating organ. I think if you're not doing that, you're missing out. So, I always just loved thinking about what makes us human, what makes us tick, how the brain works, all these different syndromes that present when things don't work that are kind of fascinating. And for a while, I was a little bit uncertain what direction I would follow. I did like internal, but I did like psychiatry a lot as well. And I thought neurology got that balance of some internal medicine, some psychiatry, and still could focus on the brain. And I sort of made a chart for myself and thought about it, and that's kind of how I decided to go for neurology. And then movement itself, I think my interest was first sparked back in medical school. I was in a lecture on movement disorders, and it was great to see because the professor was amazing, Maria San Giorgio. I'm still friends with her now on Facebook, and this is up in New York, and she was just kind of physically demonstrating what lead pipe rigidity was and cogwheeling and these different things that as a student is very abstract. They're words on a page, but you don't know what that means in real life. And she kind of demoed and talked about what she did. And I don't know, it's one of those things, like it just piqued my interest. Like, why do you like podcasts or, this kind of thing? It just seemed to call to me. And when I did my neurology residency, I knew I wanted to we have the option to do some electives to explore areas. I feel like the general neurologist, unless you're in private practice, and some people do, but a lot of people have specialized, even if they go into private. So you're looking at epilepsy or stroke or movement disorders, and they are all so different from each other. It's like comparing, say, what a GI doc does to a cardiologist to a pulmonologist. They all really have different focus, different medications, different training, and that kind of thing. And being on my elective, and that was with Dr. Cheryl Waters at Columbia, and she's just amazing. First, a huge champion of women, so it was just fun hanging out with her. And her patients adored her, not only her patients, but their families. You could see the connection she had with them. And, when you're writing your essays about why you wanted to go medical school or why you want to do this, it's like, at the heart of it, most people want to help others and have that human connection and have it be sort of bi-directional. My husband, for example, works in the emergency room, so he rarely sees people again. Of course, you have your repeats, but it's once and done. And I really liked you think of a doctors are going, that's your pediatrician. I really enjoyed that relationship with my pediatrician, and I wanted to have something like that with my own patients in the future. Um, and this showed me that you could really have that here in movement disorders. So that was very important to me. And she was, very active in clinical trials. So years
Mm.
before, say, the Duopa pump came out, she was in a clinical trial for it. So I saw all these different, sort of treatments and medications that you could do. It was no longer the sort of diagnose and adios that we had known of neurology before. And it just clicked. I just really liked it. I'm like, I think I want to do this. So it was the best 2 weeks of my residency.
That's awesome. That is awesome. And you mentioned your husband works in the emergency room. Is he a doctor as well?
He's a doctor, nurse practitioner. So he finished a
Okay.
doctorate degree, but he did start off the nursing, did a DNP degree after that,
Gotcha. Wow.
and worked in between. So he has a lot of clinical hands-on experience.
So a busy household. If the two of
We
you
are
are in the medical
busy.
field. Yeah.
Yes, we are
Wow.
busy. And our kids have, you could say, both suffered and benefited from some benign neglect. They're very independent.
Yes. Yeah, exactly, right?
Yeah.
Gotcha.
They'll do fine on their own, we know. So,
Wow. Well, that's great. So thank you for being in the medical field and for being in the movement disorder field, because as a person with Parkinson's, I definitely appreciate that. And you have a way of breaking things down, like I was saying before, like into these little chunks. Um, Parkinson's is such a complex condition, and
mhm.
you make those complexities understandable and kind of in plain speak, which I really appreciate. As the ParkDoc, going into this, um, you have your choice of things to cover and things like that. Is there a subject right now that's really on the forefront of your mind, like we really need to talk about this in the Parkinson's community?
Yes, I'm so happy you asked that question, Mark, because the topic that I'd love to be known for this one day, the lady who won't stop talking about this. And this is blood pressure issues in Parkinson's, because I feel this is not talked about enough, not understood enough, not appreciated, and affects quality of life so much.
Hmm.
And I feel like with more understanding, recognition, and treatment, that we could really change how people live. I find that a lot of things I do as a movement disorder, when someone comes to me, say from a general neurologist or someone else, just tweaks. It's not always radical, but
Hmm.
just helping sustain blood pressure. If you're getting blood to your brain and you're thinking better and you're less tired and you feel like you have more energy and can move around more safely because you don't feel like you're about to fall or off balance, that could be a huge difference for somebody. And that's one of those areas where I see you can make a significant difference. And it is something that I feel I need to push on, because we've all been conditioned our entire lives that low blood pressure is good. And in general, that's true, but we kind of know, I call Parkinson's its own kind of universe, and it has its own laws. And sort of what works
Yes.
for the general population does not work in Parkinson's. There are certain
Yes.
things that are either contraindicated or need to be done just differently. And in medicine in general, big believer of tailoring to the patient, but especially as a whole, I would say as a whole group, Parkinson's really need to have their kind of own sort of approach or guidelines, and especially as it relates to blood pressure.
Hmm. That is so amazing. I have a very good friend whose blood pressure goes so low that she has to take measures to get it up. And what's interesting, now she lives in Europe, so
Hmm.
medical practices may be a little different. But when this happened, her doctor was like, eat olives, drink coffee. I mean, all these things that I was like, really? Is that what we're telling people? That like all the stuff we've been told to avoid? It's like do that so you can be healthy. But the blood pressure, it's like, oh my God, are you dead? And I'm not kidding. Her blood pressure
Yeah,
gets so low, it's like, oh my
yeah,
gosh. And I can't imagine how that impacts the energy level and other things. Just so I love the fact that you're talking about that, because I've met other people since then, since meeting my friend, that struggle with this. Now, I don't have low blood pressure issues, but it's more prevalent than I first realized.
Hmm. Oh, completely. And I don't think people, and I was actually surprised. I don't know if it was the Parkinson's Foundation or somebody online put some of the early non-motor symptoms of Parkinson's, and they listed, feeling dizzy with standing, drops in blood pressure. And I usually think of that as a later symptom, but the more I've been talking, especially with young onset women, they've been saying, we have a mutual friend, I'm sure you know, Amy Strong AF,
Hmm.
Amy Crest, and she's early on in her journey, and she initially from the get-go had a lot of blood pressure issues.
Mm.
Um, and you don't want something interfering with the one thing, especially we know that is the best thing in terms of progression, right? I don't
Yeah.
need to say what that is. We need to be exercising.
Yep.
So if you're getting, dizzy doing that or avoiding it, then we need to like really regroup.
Yes. Absolutely. You got to keep that exercise going, and anything that's roadblocking that needs to be dealt with. Absolutely. Now, you mentioned something that I wanted to touch on today too, and I had an episode in season one with Joe Tosh from the UK about women with Parkinson's. When I went to the World Parkinson's Congress in Barcelona, Spain, when they wrapped up, Eli Pollard from the front desk for the lectern said, "I want you to focus on two things going forward: caregivers and also women with Parkinson's. We need to have a bigger focus on women with Parkinson's, especially in research and in numbers. I mean, there a lot of data is collected from about men, and since that time, I have been doing that. I've been trying to do that. I'm trying to keep my word. And you mentioned women with Parkinson's, and
Mhm.
um, such a unique perspective. I'm just going to say it. Us guys don't understand what it's like to go through like a menstrual period with
Right.
Parkinson's and have those hormonal fluctuations or whatever. How do we get more focus on women with Parkinson's? I mean, we can say, hey, we're out there. We can hashtag. We can do whatever. But I mean, what's something we can do practically to help spotlight and forefront women with Parkinson's, especially young onset women still in the
Right.
workplace, that kind of thing, right?
That's a great question and something I've been thinking about myself. Um, I think what we're doing right here, just having these conversations, and I plan to, make more posts about that. And also thinking about working with Esther, shaking my boots on a paper about women and Parkinson's, because I can bring sort of the clinical perspective, but she brings in valuable patient perspective, and she
Yes.
has her finger on the pulse too of what's, talking to so many women and their experience. So getting it out in the literature more and making people aware. I think, for example, I think a lot of people appreciated the post I did on hormone replacement therapy.
Mm,
And um, this, so I've heard, does not cross the minds of my male colleagues when they're treating Parkinson's women, and mainly because it's not taught. No one talks about it in medical school or training, and that was something I had to learn on my own experience, having gone or going through perimenopause. I know what
mm,
effect it has on the brain and the mood and all of that, and what a life-changing experience it was getting on the right therapy for me. And a lot of these symptoms that you can have overlap. The Venn diagram is very juicy in the middle about what are Parkinson's symptoms and what are symptoms of perimenopause, the
mm,
cognitive and psychiatric symptoms. Um, because you're having that drop in estrogen, which
mhm.
we think is protective, or we know is protective of dopamine and various mechanisms, which is why I thought that maybe fewer women ultimately have Parkinson's than men. Um, so and you hear if you get in these forums that around their menstrual period when the estrogen we know drops that they need more dopamine, and that's not something I ever encountered in fellowship or anything like that to address. It's something, but I think it's like, I feel like perimenopause and menopause is having a moment right now.
Hmm.
And the general milieu, you see a lot of chatter about that online, which has been helpful to me. It helped me recognize my own symptoms and what I was going through. And because I'd bring it up to a doctor or somebody, and I do look young for my age, and they're always like, "Oh, that can't be you. They just got kind of got brushed off or something like that." And I'm like, I kind of know my body.
Yeah.
Um, so, and it took some fighting to get what I needed, but I think having that power and that knowledge it makes you empowered to have better conversations with
Yes.
your doctor. And I think it has to start probably in fellowship training. So maybe working with like foundations, like I work at a Parkinson Foundation Center of Excellence. So
Mm.
I work with the Parkinson Foundation quite a bit, and they put out great educational material. Maybe starting there and getting out more information um, that starts being taught already at the fellow level, that they
Yeah.
know that this is something at least to recognize or think about or appreciate and adjust. And the medical system too, it's not made for this kind of more fluid kind of approach. It's like you write a script and it's very constricted in terms of what prescriptive, really,
Yeah.
in what you can put in there, like 30 pills a day and you kind of need to have a little bit of wiggle room sometimes to take more on a certain day when you need it. So the medical system itself, even just practically, doesn't always make that very easy.
Right.
And if you've ever been a controlled substance, you know how difficult it can. 30 days, and you can't like refill it a day too soon, or the pharmacy gets upset. So it can be difficult. So
Yeah. Interesting. You know, the hormone issue, I did a post about this, isn't just about women. And I don't want to take the focus of women, but as we're talking about hormones, I did a post about how when I looked at the symptoms of low testosterone
mm,
and the foggy brain, and it's like, geez, like you said, all these things kind of cross over with Parkinson's. It's like I want to make sure that what I'm experiencing isn't low testosterone. And so I've been on testosterone therapy, and I did in my post, I actually showed myself giving myself an injection because
okay,
I don't want that to be a factor like, well, maybe it's just low testosterone. No, I want to keep that testosterone level up. I mean, once for my health and well-being and whatnot, but also to make it easier to understand it. No, this is Parkinson's, kind of thing.
right,
And that's a great conversation about testosterone replacement for men and women. But again, I don't want to take the focus off
absolutely.
women. So yeah. And when you talk about Esther having the finger on the pulse, I love that approach of from the standpoint you're coming from the medical side, or from the professional side. She's coming from the lived experience side, and that's a great way to approach it. That's fantastic. And love if you guys get a paper out there. I want to know, and I'm sure you'll get it
Well,
out there.
like you'll be the
Yeah.
first one to know, Mark.
Awesome, good stuff. That's great stuff. Now with Parkinson's, we can do a lot of complaining, and
Mm-hmm.
we can have our bad days and whatnot. But I was told about a story recently, um, and it's kind of sad. But there was a grape that was crossing the road, and it got stepped on.
What? A
A
grape?
grape. It was a grape. It was walking along, and it got stepped on. You know what it said?
Um, I need to whine now about being crushed.
Good. Well, what it was it didn't say anything. It just let out a little whine. So
Okay.
you're on the mark there. There you go. That's awesome.
On the mark.
I love it. That's good. That's good stuff.
Yeah.
Sorry, I have to throw a dad joke in there, and
No,
that's
I
just me.
love
So
it.
yeah.
I love it.
So um, okay. So with your foray into social media, you probably get, I'm guessing, a lot of questions. Yeah,
Hmm.
you being a medical doctor and also being on social media. Do you set any parameters like I'm not going to answer this or that, or how do you? Because I get questions, I get medical questions. I know Esther does too, and we'll actually
Yeah.
post once in a while. I am not a medical doctor. I just give my
Right.
experience kind of thing. But you are a doctor, so when those people come to you, how do you handle that? Does that make sense?
Oh, it absolutely makes sense. It is. I've actually gone into AI to kind of figure out where my boundaries are because I'm a licensed professional, and technically, I can't give someone personalized medical advice because then I'm establishing a physician-patient relationship.
Right.
And I don't necessarily also have license in their state or where they are, which you need in America, which is ridiculous, but that's, another podcast. Um, because, the human body does not change from state to state. I think we should have universal medical licenses, which would allow telehealth, which would allow more access to MDSs throughout, et cetera, et cetera. But I digress.
Great
um,
topics, but great topics.
yeah, we can put those on the back burner for another time. But what was I talking about again? I
About
forgot.
setting parameters with
Oh,
people
setting
that,
parameters,
yeah.
right? So, and I think I'm probably going to have to set more parameters as time goes by and there's more people because it's just been steadily increasing. And at a certain point, I have a full-time job and family, so I can't just, answer the questions. But I also try to answer and keep it in general. So, like,
Mm,
in general, what I like to do is X, Y, and Z,
right.
and try to help out because, I want to help out as I can. I can't say specifically, but in general, what might be some good ideas to explore with your own doctor.
Right.
I think people are desperate for some extra help. I've gotten requests if I could do a consultation or telehealth, and unfortunately, I can't. I would love to.
Mm,
That would be kind of fun, and I feel like you could just kind of tweak some things and get people feeling a lot better. I feel like um, knowing sort of the neurologist crisis in America right now, we don't have enough neurologists. I have people
yes.
complaining about how long it takes to get in. Like my wait time is like 6 months. And I said, well, get your grandkids to go into neurology,
Yeah. Yeah.
do something about it because I can't. I'm trying my best over here. So anything we can do to, and the boomers are booming and the population is aging and people are having fewer babies. So you can see the skew.
Yeah.
And who's going to take care of these people and take care of them well, right? It's
Mm,
not just about like surviving, it's also about thriving, right?
yeah.
So, kind of breaking down those barriers. And that's one of the reasons I've also been involved in kind of advocacy and going. I've been with the American Academy of Neurology. We do an event called On the Hill where we go to Capitol Hill and we're advocating for extending telehealth flexibilities. Did the same thing when I went in September last year. As part of the PD policy forum, also we were advocating for, because these are all temporary flexibilities. They're not ingrained in law yet. So
Yeah.
anytime there's a government shutdown too, as we had in the fall, those go away. Technically, you can't have telehealth. And the reason is because they have the budget for telehealth and all of that,
Mm,
and that will require money. Whereas if you just say, let's just extend it, we keep kicking the can down the road without any kind of more permanent solution.
mm,
But I think that would really kind of help. It's upsetting. I want to like help people more directly, but I can't.
yeah. Now I live in Phoenix, so the inevitable question: are you coming to the World Parkinson's Congress?
Well, I need an invitation.
You
Someone
do?
to sponsor me. I
Uh,
do, and I believe it's closed, the registration too. I would love to go. Now that I've met so many people in the community, I want to go to the World Park and just kind of hang out with everybody and
yes.
learn and exchange ideas. I think it would be so great. Like I was saying, like this paper, like with Esther, just having these conversations really kind of opens up these opportunities and kind of education. And like I was saying at one point, like I um, started this kind of as like, I don't know, you call it like a good deed or something. Because I read that really kind of striking statistic that only 9% of Parkinson's patients see a movement disorder specialist,
Yes.
put out by the Parkinson Foundation. And I've been in islands of like, of good supply. Did my training in New York City area where you had, a movement disorder down every block. It's highly concentrated, and I'm in Augusta, Georgia, at a center of excellence, so plenty of movement people here, or enough to kind of meet the need. I didn't realize what deserts existed
Yes.
outside of that, and I was like, I'm just going to put some education out there, and maybe it'll help someone, just for funsies.
Yeah. Yeah. Yeah.
But I say this not to be like cheesy or whatever, but the stuff I'm just like learning back, and the friendships and the stuff, because I see people, it's a snapshot in time. I see you,
Right.
for an hour. I get a picture. You're different points, in your cycle of your medication. And it's a different thing to be living with this day in and day out, and also having conversations with other people, which a lot of Parkinson's patients do, and comparing experiences.
Right.
So that has been really interesting for me too.
Well, I'll tell you, that was actually my favorite part of the World Parkinson's Congress in Barcelona was meeting other people that I've chatted with online but never met in person.
Hmm.
And sometimes it was literally like screaming and hugging and like, oh my
I
God,
know.
like,
I just can't
you're
wait to hug everybody.
exactly right. You're here, you're here. I remember meeting not the fake Amber from El Paso,
Uh-huh.
who when I first got online, I was like,
Oh, she's
oh,
funny.
yeah, oh, exactly. I was like, there's somebody doing stuff right. Um,
Yeah.
and just but to your point, you scream, you hug, you have all that stuff, but then maybe when the sessions are over in the afternoon, maybe you go to dinner with some of these people, and over dinner you're chit chatting, you're talking, and
Yeah.
ideas form, and it's just it really is an amazing experience. So yeah, to your
So
point.
I'm waiting for my invitation.
Okay, gotcha. Duly noted, duly noted. I appreciate that. So now, with that, you are a doctor, you advocate online, you do a lot of different things. What's your favorite thing that you do as the medical professional that you are? Is it seeing patients in person? Is it posting online? Is it what is it? What do you like? What do you enjoy the most?
Well, currently my favorite thing is posting online, because it has given it's kind of a breath of fresh air. I've been doing movement disorders now for like 12 years, and sometimes the things I say start sounding repetitive to me, and I feel like I'm reaching like one person at a time. And my I just say for now it's the social. My primary love is seeing patients. Just like
Right.
I said during my felt like residency, just having that relationship. And there is such a thing as a Parkinson's personality. There's been literature about it, and I just think Parkies are just the nicest, best people ever. I'm blessed to have such a wonderful patient population, and really becomes a lot like friendships. I really
Yeah.
enjoy that. But sometimes I wish I was inspired a lot by a dermatologist that I follow, Dr. Idris, and I actually did residency with her sister, so it's a little bit of a personal connection. I haven't met her, but she used to say, I say the same thing in clinic, and like I wish I could like tell so many more people at once. And I'm like, that makes sense. And there's also a lot of misinformation
Hmm.
out there, and I think this is really kind of helped tap into my creativity, and just meeting all these people has just been such a fun experience. And I always joke that I learned about things from my patients, because Parkinson's, they're researching, they got their finger on the pulse. And like recently someone just brought up the Movive device. It's, I think it's some kind of an auditory cueing device to help with walking. And I feel like I'm always like kept on my toes and need to have my finger on the pulse. So just doing this, make sure I stay on top of the latest research and what's going on. So it kind of breathes in this fresh air for me. So that's been really fun.
Right. Now I'm going to go back to something you just talked about because my Parkinson's brain is bad and I forget things. And as you were
Yeah.
talking, I was going to say this and then I forgot. So I'm going to go back. This is today's edition of Mark My Words. So
Okay.
you talked about the desert of areas without movement disorder specialists. Now I live in Phoenix. Phoenix,
Mm-hmm.
and we have the Muhammad Ali Parkinson Center, Barrow Neurological Center of
Right.
Excellence, right? Um, and I often get teased about the great experiences I've had with doctors because from diagnosis to present day, I've had nothing but wonderful doctors, great experiences, and not everybody goes through that. I have a good friend who lives in northern Michigan, and to find a movement disorder specialist, to find a neurologist, it was 4 hour drive. To get to a movement
What?
disorder specialist is usually about an 8 hour drive.
What?
And she actually had to go from Michigan to um, the Cleveland Clinic to get
Hmm.
a more exhaustive work done, which ultimately overturned her Parkinson's diagnosis. And I'm
Oh,
actually going to
wow.
do an episode on this, but to get that neurological care she needed, she had to take like a week and go to and stay there for like 3 or 4 days at the
Hmm.
Cleveland Clinic. And it opened my eyes to, as you put it, the desert areas, the desert regions of where they're lacking in neurological care in person. And that is something we need to change. And like you said, encourage your grandchild to get into medical school and become a neurologist, right? But
Yeah.
if it's not that, is it, like you said, expanding the abilities of teledoc for people to have people or whatever? But the need for neurologists and specifically movement disorder specialists is great. And that the Parkinson's Foundation actually backed off. They used to recommend you should always see a movement disorder specialist until they
Yeah.
realized those statistics that you mentioned, that it's
Right.
not feasible for a lot of people. They just simply
No.
can't do it. So they've backed off on that communication. And that is something that, however we do it, we got to get more focus on getting people to go down that road of being in neurology and specifically movement disorder specialists. So that's my edition of Mark My Words for today, because that is a big issue that so many people
Big
face.
issue.
I am a fortunate one. You, like you said, you have been on that island, in New York and where you are now, Augusta. But that is so not the case for so many people, and I hear it so frequently. So good stuff. Okay, so one thing you mentioned, the Parkinson's personality. One thing I've noticed in the Parkinson's community is the use of sense of humor. I
Mm.
have seen this in a lot of people. Actually, I've noticed in that are dealing with chronic illnesses. Don't have to be Parkinson's. Use humor, but I have a very dark sense of humor, and I've seen this in the Parkinson's community where people use a sense of humor to deal with that Parkinson's or that diagnosis.
Hmm.
Do you use humor to overcome adversity or to deal with things in your life?
Oh, absolutely. And I don't think you can go into medicine without having a dark sense of humor. It's just you can't. You see things that are bad that can't be unseen, and
Hmm.
you have to have that, release mechanism and be able to compartmentalize a little bit. And I just, in general, as a person, value having a sense of humor as well. You inspired me actually with one of my posts. I had there's a neurologist in my office, Dr. Benjamin Barnes. He's a neuromuscular guy, and he's always walking around saying dad jokes. So I caught one of his on camera. Did you get to see that one?
No, I'll have to go
But
back
it
and look
was
at that one.
well, I'll turn it on you. I'll give you the joke now. It's like, what should you do if you're cold?
What should you do with your cold? I don't know.
You should go stand in a corner
Why should you stand in a corner?
because it's 90 degrees.
I like it. I know.
Yeah,
Hold on. Wait a minute. Wait a
but
minute. Do I have my? There we go.
or you have your drum roll, your rim shot.
If it's gonna go. Okay.
Oh,
Yeah.
oh,
I'm
so
sorry. It took a long
professional.
time. For
That's
whatever reason, it
okay.
wasn't queued up the way it was supposed to be. Here we go. There we go. Okay. There.
There we go.
I love it. Good
So
stuff.
yeah, a sense of humor is because it's like, what choice do you have?
Yeah.
Do you cry or do you laugh? Um, and laughing is definitely the better of the two. And I remember looking at this striking numbers. They showed a study, and I don't remember where it was from, but it was from the PF Centers for Leadership Conference.
Uh huh.
It's not the one in Vegas, but the one before that. I think that was in Austin, I believe.
Okay.
'Cause there's one in or Nashville. I
Nashville.
think it was
The one
Nashville,
in Nashville. Yeah.
Nashville
Okay.
last
Gotcha.
time. It was Nashville. And they did a study where they kind of tracked people and they accounted for differences in age as well as symptoms. And even people with the same symptoms, they showed a path. Some people have a much rockier and more difficult path and don't end up doing as well.
Hmm.
Compared to, they showed a road next to it that was really nicely, paved and smooth. And what makes the difference between one road versus the other, and people have similar symptoms, and every age, everything was accounted for. It was attitude and
Mm,
sort of having that sense of humor, like you said. Um, you know, we'd all wish if we had Parkinson's that we could, have a cure and undo it, but it is what it is. And while you have it, how can you live as best as possible with it,
right.
And it does you no good to cry. I mean, have a cry sometimes. I'm saying not,
Yeah, yeah.
but just having a good humor. Not only you just like feel better, right? Because you laugh, you release like good chem. I love laughing. That's my kind of my self care. I go to see comedy shows. I last
Mm,
saw John Mulaney, and just
mm,
traveled to Nashville again to see Noah Trevor, or
nice.
Trevor Noah. um, and yeah, it makes it better. And if that doesn't convince you, the data shows that you'll have a better path and an
Yeah.
easier kind of journey if you do so. So try to find that nugget of humor in something, and the darker the better, Sometimes,
Yeah, yeah.
yeah,
Well, and not to focus on Amber, but I mentioned Amber, not the fake Amber. If you can find her on TikTok and in the Instagram, but she has a tattoo sleeve of things that she does really well because of Parkinson's. There's like a maraca, there's a salt shaker, there's a drink mixer, and when I saw it, like, that is great, that is wonderful, and um, I use humor to get through things. And you mentioned the positive mindset. I don't know if I can see this on camera, but I have a tattoo on my arm,
yeah.
right?
And the
And
tulip.
so I've got
Uh-huh.
the International Parkinson symbol, and then below that I have my diagnosis date. And I told
Right.
the tattoo artist below that needs to be a blank space because I'm leaving that for my cure date because I'm an optimist and I believe in my
Okay.
lifetime there will be a cure. And this
Okay.
guy got so hyped up. He's like, dude, yeah, man, my grandfather's got Parkinson's. Yeah, you're going to be a repeat customer. You're going to come back and we're going to put that cure date on there. And it just pumped him up. And
Wow.
it was so cool.
Okay.
And so this tattoo is a reminder for me to stay optimistic, to stay
Right.
focused, and just, you know what?
Yeah.
It may happen in my lifetime, and I'm gonna stick to it. And if it doesn't, then I've had a lifelong time of optimism. What's the
Right.
harm in that? So yeah,
There's no harm in that, and you'll still be better for it, right?
yep, yep,
And as
exactly,
Michael J. Fox says, with gratitude, right? Optimism is sustainable.
yep. One of my favorite one of my favorite quotes, and I actually have that on my LinkedIn banner. That quote's on that
Hmm.
on my LinkedIn banner because I absolutely love that
Okay.
quote. It's amazing.
Yeah. I think that, is good for everyone, whether you have
Absolutely.
Parkinson's or not. Yeah.
Yep. Okay, so this is the part of the show that I call "Get to the Chopper." Get to the chopper! This is when the helicopters are coming in to extract us and take us back home to our families. The movie's coming to an end. The credits are going to roll. And so we look back on today's episode. And Julie, what's the one thing you want people to take away from today's episode? What's the one thing you want people to think about? And it may be something you haven't even covered today, but what's the one thing you want people to think about?
Well, selfishly, I want them to think about their blood pressure,
Yeah,
honestly, because there isn't enough conversation about that, and just being open to thinking about that and ways to raise it, because it can really improve your quality of life. And if that message reaches somebody and it helps them, my mission is accomplished.
excellent, excellent. My takeaway is going to be the continued need for focus on women with Parkinson's, especially young onset
Mm,
Parkinson's.
yes.
That is something that I continue to say. I mean, again, I'm a guy, but I care
We
about
need
this.
champions who are guys.
Exactly. We need people to champion that cause no matter what the case, right? And
Right.
it is something that I see is still a big need. Even though
Huge.
I don't know what it's like to be a woman going through these things, I do see the need, and medically we need to be open to that. So just talking about that, the need to champion women with Parkinson's, and again,
Hmm.
especially young onset, I think that's so critical. So there you go. That's my takeaway from today. My get to the chopper moment. So there you
Yeah.
go.
Oh, that's a great takeaway, and one for the ages. Um, have you had some young onset women on? I'm sure you have.
I have, and I will have more actually too. And
Yeah.
but one thing about this podcast, um, this podcast has been inspired by my online account, which I've told people from day one. It's not about Parkinson's. It's about my life with Parkinson's. It's about living with
Right.
Parkinson's. And
Right.
so there's been times I've had my life coach on. I have a friend who's a mindset coach. She works with athletes, and she's a sports psychologist. So I because mindset is so important with Parkinson's, right?
Oh, so important.
Yeah. So uh, I do plan on having more here. This is season two. I'll have more on in season two, and it's going to be something that I don't stop talking about. That and caregivers, the need for caregivers,
Yeah.
attention and focus on that. So, yep, good stuff.
You've created a great team around yourself.
Um, you know, I have. It's not the team I was expecting. But to your point,
Okay.
because um, when I was diagnosed, things didn't go as I had planned with the people closest around me. Okay, but I
Yeah.
have now adapted and adjusted, and I know my needs. And depression, I struggle with depression so much,
Yeah.
and apathy. And I know you posted recently about apathy, apathy, and my friend from Minnesota who has Parkinson's, she said to me one day, apathy and depression, you think those two would be conflictive? I mean, if you don't care about anything, why would you be depressed, right? But her statement was,
Funny.
yeah,
That's that dark humor that.
well, her next comment was, but you think those two wouldn't be present together? But she goes, but those two bitches have play dates together. I'm like, I know, right?
You know?
And so it's funny, but those are the things I struggle with. So mindset is something I really focus on, and trying to
Mm.
adjust my mindset and to deal with that. I'm going to do a post pretty soon about um, a antidepressant that I took. I increased my dose and the negative effect it had.
Mm.
And so I want to talk about things like that as well. But there's, yes, lots of
Oh
things
yeah,
to
that's
talk.
important.
Yeah.
Sometimes less is more, right?
Yes. Well, and I'll talk about that here real quickly.
Yeah.
Um, I'm on duloxetine, and my
Mhm.
doctor said, how you doing? And I said, well, I still struggle with depression, here and there, but I'm not as bad as I was, and I'm okay. And she goes, do you want to up the medical? And by the way, my doctor always asks the question. She never says we're going to do this. She always
Right.
asks the question, what do you think, right? And I said, okay,
Mhm.
yeah, because I was taking the lowest dose that's there, right? So I said,
Yeah.
okay, let's take it up a notch and see what happens, right? And we did, and not right away, but around like week one in, I went off the charts. I literally I was so depressed, so even getting to be
Really?
suicidal. And my
Wow.
friend, the mindset coach, I called her in a crisis, and she immediately started, okay, have you had any changes? What's changed in your life? And we got to medication. And I said, well, my doctor increased my antidepressant. She goes, okay, do me a favor. I want you to go back to your original dose. Don't go off
Mhm.
it. You can't go off it, but go back to your original dose, and call her and tell her right away what happened. She goes, and I did that, and I was back to normal. Like
Okay.
in a day and a half.
Mhm.
And thank God she was there, and she knew those
Right.
things to think about. And once she said that, and then I started Googling it, and you
Mhm.
Google like what antidepressants do, and yes, antidepressants will make you depressed and suicidal. I'm like, oh my God, right? So a big eye-opening experience for me, and it was very dramatic. And of course, my doctor, I spoke with her, and we adjusted accordingly. But oh my gosh, but that increment, and thank God I had somebody there to help me with that. Without that, I don't know where I would have gone, because I was thinking it was me. It was a mark issue, not correlating it to the increase in the antidepressant, right? So, I mean,
Yeah.
you increase the antidepressant, you should be less depressed and less suicidal. I went into a deep dark dive. So yeah, but yeah, I'll do a post about that here coming up.
That's an interesting point because antidepressants, they and I counsel everyone I start on one that it takes 4 to 6 weeks, a month or a month and a half to really notice positive change or
Yeah.
difference. It's not right away, and you have to take it every day. It's not an Advil.
Right.
It's kind of modulating things slowly. What happens, I learned, is that when oops, when you start, this is kind of goes back to your comment about apathy and depression. When you're really depressed, you're also kind of inactivated.
Mm.
You just kind of don't have a lot of energy. You don't do a lot as much as you're used to. And there's a lot of overlap. There's that Venn diagram too, where apathy and depression. And that's one of those things, just kind of having that lack of initiative to kind of do things. And what happens as the antidepressant is starting to work is that you get activated.
Mm.
So supposedly this is one of the things that I've heard, is that you have more energy to do things. For example, kill yourself. And the emotional regulation has not caught up yet, the improvement in the mood. So you're in this kind of difficult limbo space where you're a little activated, but still have these dark thoughts. And that can be a dangerous combination, which is why there are these sort of black box warnings, and always should be done under the supervision of a physician. And I'm so glad you had that, friend or your therapist or coach to kind of guide you in the right direction.
Sports psychologist. Yeah.
But I think that's a good rule in general. Like if something changes, to kind of take a step back and think about what is different. You're online a good bit, so I'm sure you've seen like these like videos or memes of somebody is just like kind of just feeling really down and in the dumps, and they're like, "Did you eat? No. Did you drink? No. Did you go outside today? No. Did you exercise? No." And you start to realize, you're like, wait a minute, I'm not watering this plant. But in general, when I start a medication, I usually try to do just one change at a time. Just do one medication, because then you can see what the benefit is or the side effect. For example, if we started the duloxetine or Cymbalta, increase at the same time as maybe we kind of increased your levodopa or something like that, we're like, well, which one is it? And you're kind of stuck at not knowing.
Yep.
So I know sometimes people are eager to do a lot of, and I started off that way. I come up with a big list and want to change everything and fix it all up, and you just have to kind of take it in a measured, scientific way. So I really liked the way she did that and kind of broke it down. And that's a good thing in the future if something changes, to kind of pause, step back, and be like, what's different here? What changed? So sometimes we don't know, but sometimes you can find a convenient answer like that worked.
Absolutely. And that's why I journal all of my symptom spikes or things like that. I put it on a calendar. On this day, this happened. And you've heard me talk about the dude, my first movement disorder specialist. He was that way. He said he would ask me, "What's the one thing you want to focus on?" And we're going to focus on that. And then once we get through that, we'll go to the next thing, right?
Right.
And one step at a time. And I love that approach. That's the way I think it should be done. So
yeah.
Well, Julie, you are an absolute wonder, and I thank you so much for being on. I have so much fun with you, and I love seeing you
Likewise.
online. You're just a great presence, like I said, giving solid morsels for us to chew on, and just such a great presence, and so approachable. I was kind of a little intimidated, to meet you in person. I was like, oh my gosh, it's I get all like shy and like, oh my God, but you were so nice to me and so approachable. I really appreciate that. So thank you so much.
Yeah, I just remember just clicking with you. I think it was in Austin in the lobby. We're waiting for our our ride to the airport after that conference there. Right. And you told me about your online thing, and I don't remember when I started doing my online thing, somehow we had connected again. I was so excited that I found you.
Yeah.
So I was worried about meeting you.
Yeah.
The big podcaster.
That is well, thank you.
Yeah.
Well, thank you so much for being on, and people can find you at the ParkDoc on Instagram, correct? And on TikTok, right?
Yes. And I also have Facebook as well.
Okay.
But you have to kind of search within Facebook, like ParkDoc. If you just go and Google, it doesn't show up.
Got it. Okay. Well, again, thank you for being on.
Thank you.
Your information is going to be in the show notes, and if you don't mind, I will plan on having you back on the show because you're a wonderful guest, very informative and
Thank you.
very entertaining. So, thank you so much.
Thank you so much for having me. I look forward to coming back.
Awesome. And for my listeners out there, guys, thank you so much for listening. We really appreciate it. As always, I'm going to remind you guys, life is not a destination. Life is a journey. So get out there and keep exploring. Take care, guys. God bless, and we'll talk to you soon. Thanks for joining me on this edition of Mark in the Park, the podcast. If you enjoyed this episode, please like, subscribe, and leave a review. Your support helps more people discover the show. For show notes, updates, and future episodes, or to connect, head over to markinthepark21.com. Got a guest idea or a topic suggestion? Drop me a line at markintheparkpodcast@gmail.com. I'd love to hear from you. And to all my listeners, this is Mark Milo reminding you, life is as much about the journey as the destination. So enjoy the sights and sounds along the way. Thanks for listening, and until next time, keep exploring.